Welcome to the Ticktective podcast and video series, a program of the Bay Area Lyme Foundation, where our mission is to make Lyme disease easy to diagnose and simple to cure. I'm your host, Leah Gertner, Director of Education and Outreach. Lyme disease is the most common vector-borne disease in the USA and is a global issue. This show includes interviews with the researchers we fund, as well as other interesting people in the Lyme scientific community. We are a nonprofit foundation based in Silicon Valley. Thanks to a generous grant that covers all of our overhead, 100% of all donations go directly to support research and prevention programs. You can find out more or donate at bayarealyme.org. Today, I'd like to welcome Dana Parish, who's an advisory board member at the Bay Area Lyme Foundation, to our Ticktective podcast and video series. Thank you so much for joining us today.
Thank you for having me, Leah. It's great to see you.
Dana Parish is the co-author of the book Chronic and a New York City-based singer-songwriter. Dana became one of the highest charting independent artists and broke into the top 10 a few years ago. Dana has collaborated with Michael Jackson, Celine Dion, and Carly Rae Jepsen, amongst many others. But in July of 2014, Dana went to a wedding on Long Beach Island in New Jersey and came back to New York City with what she would soon find out to be a severe case of Lyme disease that would change the course of her and our lives. After 3 weeks of antibiotics that she was told would cure her, she went on to have severe multisystemic symptoms that resulted 5 months later in heart failure. Dana saw a dozen doctors at top New York City medical institutions, and none would consider that she still had Lyme disease after the first course of antibiotics.
Yes.
Dana ultimately found Yale-trained specialist Dr. Stephen Phillips, who treated her ongoing infection. And together, they ended up co-authoring the book Chronic, The Hidden Cause of the Autoimmune Pandemic and How to Get Healthy Again, which we're very excited is going to be released in February of 2021. And it will be published by Houghton Mifflin Harcourt. So thank you so much for joining us today.
Thank you.
I wanted to know basically how this book was born.
Sure. Well, thank you for the great intro and for, you gave a little bit of background as to how I got into this whole Lyme mess, as I call it all the time. I really didn't even know that it existed. So once I started recovering from what was heart failure induced by Lyme and Bartonella, and I had this really severe and extremely life-altering case at the prime of my life and career, I became really curious and really interested as to why so many doctors didn't know about these pathogens, these common, stealth, sneaky, destructive pathogens. And the more I learned and the more curious I became and the more doctors I talked to and the more scientists I got to learn from, the more outraged I became that this whole entire pandemic, and it is a global pandemic, was completely misunderstood, misrepresented, and ignored. There are millions of people that are totally disenfranchised and totally sidelined with all of these symptoms and all of this unexplained mystery illness that are not able to get any help. So it made me really upset and really angry. And so as Dr. Phillips got me better, I was writing a column for the Huffington Post about Lyme disease, and I was interviewing some celebrities that had it. I got to talk to Daryl Hall, and I got a great interview with Chris Christopherson, who had Lyme-induced Alzheimer's, and he got so much better, and he's since gone on to recover his life and be back on the road and all that stuff. So as I kept hearing these same stories over and over and over, and I kept writing for the Huffington Post and did a bunch of interviews and did a lot of stuff with Dr. Phillips in terms of public awareness and public speaking and that kind of thing. We got a book agent, somebody that had been sort of following us, all of our stuff, and that is a friend of mine who also has Lyme, is a big writer herself, and she said, you guys have to get together and write a book about this. So that's what happened. We had no intention of writing a book. We had no idea that this was going to happen. We weren't seeking it. It was really born out of a very organic and authentic drive in both of us to get this crucial information to the public in a really big way. So we came up with a proposal. We came up with a little outline of the book, and we had 5 publishers bid for it. It was the most incredibly surprising and wonderful thing, but it really just showed us what desperate need the world is of understanding for this horrible disease.
You were already about to publish a book on a pandemic, and then coronavirus came in right when you were about to start your book tour. And now they want you to sort of edit the book and include, I'm guessing, a lot of the information around coronavirus. Is that right?
Yes, that's totally right. So it's supposed to come out in May, and it was then supposed to come out in August. And we had a meeting with our publisher a couple of weeks ago, and they said, you know, the truth is there's so much overlap between these two pandemics, from the bungling of them to the faulty tests, to the misunderstood multi-systemic illness, to the narrow case definition being actually in reality so broad that we want you to write another chapter. So that's why we delayed the book till February. And we're thrilled about it because it would seem kind of ridiculous and a huge missed opportunity to educate people to not draw the comparison, because there is just this incredible amount, again, of misinformation, a lot of politics involved, a lot of money involved, and it's a big, dark, ugly story, just like the tick-borne disease story.
So I'm assuming some of the similarities that you're drawing upon are the difficulty in diagnostics, the lack of adequate therapeutics for everybody. Some people will go on and recover their health, and some people will have late-stage, long-term chronic symptoms.
Right.
The lack of diagnostics leading to people suffering unnecessarily, wondering what they have, thinking they're crazy, not being able to get the help they need, not getting, I don't know about the insurance coverage with COVID. I know that it's really tough for people with late stage Lyme. It has traditionally been hard for them to get covered. Although there are new laws in several states stating that insurance companies now do need to cover treatment for late stage Lyme, but that's been a half a century battle. And then there's, of course, what's happened with the CDC and their management, along with other agencies around these diseases. And you'll be covering those topics in your book, Chronic?
Yeah, you hit on the majority of the topics that we will cover in our book, but there's one more. And this is a really important one too. The discrediting of cheap, generic, old, safe drugs in service of a vaccine and in service of newer, shiny, lifelong patents that are going to keep people potentially chronically ill but immune suppressed so that their symptoms are kept at bay. The thing with Lyme is that there are many of us, I'm one of them, who would have been relegated and defaulted to an autoimmune diagnosis had I not been lucky enough to see the bite, the bullseye, and then seriously persisted in finding out whether I had an ongoing infection and finding out the truth of it, which was yes, because 12 doctors told me no. But I knew in my gut and I knew in my heart that they were wrong. And thank God I trusted it. And I was very sick and very physically weak and very mentally tired and confused about the whole thing. I had never heard about this whole debacle in my whole life. Even growing up in New Jersey, I didn't really know that Lyme was so serious. And I think that that's really been, unfortunately, due to very, very dishonest public messaging. So one of the things I learned, and one of the major comparisons that we're going to draw, is the whole debacle about hydroxychloroquine, which is a 70-year-old, safe, cheap, generic, important drug. It's known to be safe for pregnant women and breastfeeding women. And when used early in the course of COVID, very, very early, like Tamiflu, you would use for the flu, it has shown promise in reducing the level of virulence, reducing the viral replication of COVID. How this became politicized, how this became, what it is now, I don't really know, but it's a very similar situation that we have in Lyme. So that's one of the really important points that Dr. Phillips and I are going to make in the book, and that I want to make here because I think it needs to be said. If a cheap generic course of antibiotics can get somebody out of the woods with Lyme, you don't need to put them on psychiatric drugs for the rest of their lives and Enbrel. There's a lot of money, billions and billions and billions of dollars, that drive the conversation. And it's a really big political, scandalous mess.
Do you want to name some of the autoimmune diseases that you think might have come up for you if you hadn't finally knocked on the door of somebody who actually understood what Lyme symptoms could look like beyond the stereotypical bullseye rash or fatigue.
Yeah.
It's not what most people experience when they actually get infected with a tick-borne disease, but that's what doctors seem to think is, the hallmark. And then some of the more common autoimmune diseases that you discuss in your book.
Yeah, that's a great question. I'm so happy that you asked it. Nobody has ever asked me that question. And I've thought about it so much because I spent so much time worrying that I was going to have all of these diagnoses until I really understood what the crux, what the heart of them, what the root of them really was. So yes, I had a tremor. So I thought I had Parkinson's. I had heart failure. So I don't know that that's autoimmune, but that's just another, it was like a huge symptom that I had of Lyme, and that everybody was confused by. Nobody knew why I had it. Nobody denied that I had it, but nobody knew why. I definitely could have been defaulted to an MS diagnosis. I had a lot of neurological problems. I had tingling in my extremities, and I had a lot of myalgias, a lot of also stiffness in my joints. So I think I could have had arthritis. By the way, all of this is gone. Now, the other thing that I got was very severe overnight anxiety, depression, insomnia, suicidal ideation, and OCD. All things I never had. I never, ever had. So I'm a normal person who has a life that fluctuates and goes through things, but I've never, ever had the kind of intrusive thoughts. It was so organic. It was so clear to me that something was in my brain. And I remember talking to Allie Hilfiger about it, who also famously had a very, very severe case of Lyme, wrote a memoir about it, and did an incredible amount of great work to raise the awareness. Allie told me that she told her dad she felt like there were bugs in her brain. And I completely understand, because I used to say the same thing, like there's something in my brain. I never had to take sleeping pills or any kind of sleeping aid. I also never took an antidepressant in my whole life. So these were extremely significant changes in my mental status. I'm just fascinated that this is like a common theme. And then I hear from so many mothers whose kids just literally go haywire overnight. And again, I hear the same thing. They're hallucinating. They have horrible anxiety. Also, they don't want to go to school anymore. They can't, their grades are getting bad. They have ADD overnight. And I always say, could they have been bitten by something? Could this be an infection? And oftentimes they come back to me and it was, and kids get better.
Right. Which brings up the topic of PANS and PANDAS and
Yes.
the autoimmune neurological disorders.
Yeah.
So I know the journey to proper diagnosis can be long and complicated, and it sounds like you had quite a journey. I know that you have worked with the late Dr. Neil Spector, who was a very prominent cancer researcher at Duke University who helped come up with one of the most important breast cancer drugs. And he himself had such a long struggle with Lyme disease that ended up in total heart failure, and he actually had to get a heart transplant. And it was only after the heart transplant, where he'd almost died, where he found out that what he had been struggling with had actually been an undiagnosed Lyme infection. And I know that heart served him well until recently when he lost his battle. And so we're all so sad that he's gone, such a brilliant mind. But I know that he was pivoting his brilliance and his research away from cancer and steering a little bit into Lyme, because that's sort of like you and me and so many of us. It became obvious that there was not enough research being pointed in that area. And it can be such a serious and life-threatening disease, and yet there's so little funding and so few researchers working in this area. Can you tell me a little bit about your experience working with the late Dr. Neil Spector?
Sure. Well, he was like a brother to me. We were really close friends, and we met because somebody gave me his book, and it was the first book that I read after I got my brain back, basically almost a year into my treatment for Lyme. And I read it in a Sunday afternoon, and I wrote him a letter, like everybody else in the world that reads his book, it seems. And I tried not to ask for anything in return. I really just wanted him to know that his book gave me hope. I was still a little bit sick, and I really didn't know anybody else who had what I was going through. I wasn't integrated into the Lyme community whatsoever at that point. It was just me and Dr. Phillips. I wrote to Neil, and I told him, like, I haven't written a fan letter since I wrote to Pat Benatar when I was like 7. So I just want to tell you thank you. You gave me hope. I appreciate it. Thank God you're okay. I hope you remain okay. And, you know, this book was really a gift to me, and I'm sure it's a gift for many people. And lo and behold, I get an email from him a couple hours later. I was truly shocked, saying, and by the way, I know you're a songwriter, and I've always wished that one of my poems could be turned into a song. And he had a bunch of poetry that he had written in his book that was gorgeous. So as a thank you gift and a surprise to him, I turned one of his poems into a song that was just played at his memorial called Pull You Through. So he was another, you know, just like with Dr. Phillips, when we met, we just felt a kinship and a passion to change the conversation. And as a really prominent and bulletproof cancer researcher, very well respected, and a scholar who had developed 2 major multi-billion-dollar cancer drugs that has saved so many lives. He was coming at this from a completely different angle, and he really believed, and he said on the record, and I actually did an interview with him that was called in the Huffington Post, called Lyme, the infectious disease equivalent of cancer, as his top Duke oncologist. So he told me that cancer always has a cause, and quote, most of the time it's an infection. So he was starting to find links between Bartonella, which is another vector-borne disease. I had it. Many of us who get really chronically ill from Lyme have more than one disease, one infection that we get at the same time from a tick, or maybe there are multiple hits where they're compounded from other bites or other injuries. So his work was focused on cancer, like the infectious Lyme and Bartonella causing cancer. He was also looking at other kinds of really interesting ways of diagnosing and finding out exactly where in the body the infection was. So like if you had a swollen knee, was it really an infection, or was it Lyme, or was it not? So like, you know, he just was kind of on the cutting edge of figuring out a lot of these things that have not really been looked at and talked about and researched very thoroughly. And so thankfully for Bay Area Lyme, actually, his work will be continued because his lab at Duke is going to continue the work. All cancer researchers that have turned their attention to this, because they were shocked by what they learned. Nobody had any idea that this was going on. So everybody's super passionate about it now. So hopefully these things will all see the light of day. And he was looking at therapeutics and working with Ed Breitschweit and Monica Embers and all these great scientists to bring these discoveries to the world.
Yeah, we are really excited that research is moving forward thanks to our foundation and to all the donors who've helped make it happen.
Yes.
Thank you to help organizing it all and helping to bring all these minds together. So in terms of what you were just speaking around cancer, are you referring to more like stealth pathogens, how we know the human papillomavirus can cause cervical cancer, and
right.
we know that there are certain pathogens that can trigger autoimmune diseases? And is that what you're talking about in terms of Neil Spector's book and Chronic, is this idea of pathogens causing these secondary diseases?
Absolutely. So yes, and I would say in the case of autoimmune disease, we put it in quotes because we don't believe in the concept. None of us, Neil was the same, doesn't believe in that. The whole concept is inherently flawed. There's very little evidence that the body just starts attacking itself for no reason. It's generally in the presence of something. And again, I'm going to go back to what Neil said. It's almost always an infection. And when Dr. Phillips and I wrote the book, we combed through literally over 100 years of literature. And we have 40 or 50 pages of endnotes at the end of the book of just studies. We've actually had a lot of big name scientists endorse the book because the science is so completely solid, but it's just not been disseminated widely to medical schools and to scientists. So it hasn't been a big driver of research because, again, if you solve autoimmune disease, okay, so there are 52 million Americans that have autoimmune disease right now. So if you cured a lot of those people with cheap generic antibiotics, it would be billions and billions of dollars of revenue lost for pharma who are giving these people psych drugs and immune suppressants. So you have to really look at, again, like the root cause of the denial and the root cause of the disease. And I think the most important thing is for patients to keep asking why. Why do I have this? Why was I healthy and suddenly I have psoriatic arthritis? Why do I have IBS and anxiety when I was fine 6 months ago before that camping trip? The other thing is I was bitten by a tick in my sleep. I wasn't you know, there is another misconception, and I probably just further propagated it by saying camping trip. But most people that I know that got Lyme, it wasn't so obvious. They were walking to their car from their house in New Jersey and walked through 2 steps of grass. A tick climbed up their leg, bit them behind the knee, and 3 weeks later, they can't get out of bed. They're so chronically fatigued, and it never got better. What was that? I didn't see it. Now it's disseminated and it's too late. And I'm left with, you know, once you have the bullseye, all bets are off, which leads me to another point, which is treat the bite. If you're lucky enough, if you're in that rare percentage, 25% or so that see a bite, treat it immediately with a couple weeks of antibiotics. So you don't end up like me, or you don't end up like Neil.
Right. So I notice a theme throughout what you're saying, which is that you were very persistent and you did not give up before you got the answers that you needed, and you dug and you dug and you're speaking out. And I'm wondering how your past career as a musician has helped to inform the way that you are now becoming an author and a Lyme advocate. I assume there's a lot of persistence needed, a lot of not being intimidated by negative responses or rejections or criticisms. And I figure there's probably a reason why you're able to be such a fierce advocate for the underrepresented chronic disease community.
That's a great question, because it is true. When we talk about overlap, there is a lot of overlap between what I did in music and how I kind of forged my path. And I feel like the main thing about my life is that I've always been a truth teller. When I was a little kid, and I was always writing, and I was like a very natural writer, and I always expressed myself, and I always wanted the truth no matter what it was. And I would, you know, you and I are friends, and I'm the kind of friend, I think, that you can always tell the truth to, and you know, it's okay. So I always just want the truth at all costs. And I was driven to become a songwriter because I wanted to make people feel understood. It was really important to me. I wanted to communicate certain things. And I was very young when I started writing songs, and I began to write songs because my singing teacher was giving me songs to learn all the time. My amazing, beloved Paul Atkins, who's been my teacher since I'm 12. I used to bring songs to him, or he'd give me songs, and I'd say, well, I love this song, but there are like 4 things I would never really say. And he was like, well, then write them yourself. Write your own songs if you're going to complain about the lyrics that other people write. And that's what drove me to become a songwriter. And it's very hard sometimes to be so revealing, but I found that it was very healing for people. It was very healing for me to just be very honest and very direct and vulnerable and transparent about life and the way I felt, and being a storyteller. So, and also being a songwriter for so long, you learn to say things in a very compact way, in a very short amount of space. You get to learn how to and get your message across and communicate. And that's the whole thing with all of this. And when I recognized that the truth wasn't being told about Lyme and how profound the lying was and the misinformation, I just couldn't live with it. The same way I couldn't not tell these stories that I was experiencing and get on stage and sing and talk to people and help people in ways that I never possibly could have understood. When I put out my first single, Not My Problem, I got a lot of letters from people, and I will never forget this one woman who wrote to me and said, well, I finally did it after 30 years of abuse. I finally left my husband. Thank you so much. And, you know, that's the power of the right words at the right time. And I think that as long as you're telling the truth as you know it, and you're coming from the right place, you can really make a difference. And that's really all I care about at this point, is just helping people to feel better. And that's always how I felt, but now I can do it in a different way. You know, I said what I had to say as a songwriter and as a singer. I don't feel compelled to write songs for the most part anymore the way I used to, and I have a different way of communicating. And I'm really not afraid. People come up against me all the time, but when you have the truth on your side, I welcome it. I welcome the debate. I welcome doctors challenging me on Twitter or behind the scenes. I love it, because perhaps I'll learn something, but more often what happens is they learn something, and that's really important.
Yeah, I read your February article that you wrote in USA Today with Isabel Rose, and you were speaking very succinctly. It was a very short article, but it was about the similarities between coronavirus and Lyme, and the fact that the CDC was telling people not to wear masks.
Right.
Very clearly discouraging people from wearing masks. And you even had a tweet from the
Surgeon General.
Yeah, and it said,
very condescending, very blustery, very dangerous lie. I will say that that tweet will go down as the most deadly tweet in history. Definitely. He said, hey, people, stop buying masks. You don't need them, but healthcare workers do. And this infection was known to be airborne in January. There was a study that came out of China about COVID spreading on a bus, people 9 rows up, and then it also spread to a person who came onto the bus 30 minutes after the infected person left. Right after that, there was a Biogen conference. I'm sure you remember this in Boston that spread to tons and tons of people in a big conference. So it was very clear that this was airborne very early on and that masks were imperative at that point. Why it was denied, I will never know, because I think that to communicate honestly with the public, you could have said, please don't buy N95s. We need them for our healthcare workers, but do start making and figuring out a way to wear cloth masks, the same way that they did ultimately in March or April, whenever it was. But that's something that Dr. Phillips and I came out very early. We got a lot of pushback from people, but we came out really early and said, we all need to be wearing masks. We were wearing them early. He closed his practice way earlier than most doctors. I left New York City earlier than most people because I was just following the data. Point was it's airborne. So people could have saved a lot of lives if people would have known that early on and masked up like they did in Asian countries that fared much better than we did. So yeah, that's a really big point of contention for us. And the reverberations of that lie continue. I saw an ID doctor today from Australia who said, COVID isn't airborne, so you don't need masks, they don't help. And just crazy. I mean, now it's all been exposed, but still people are reading these old messages and perpetuating this misinformation.
Yeah, I admire your fearlessness. I do recognize that often you speak out earlier than everyone else. Coming back to Lyme disease and tick-borne infections, what's some parting advice that you would have for people who have just found themselves navigating this new road that none of us ever wanted to walk down?
The first thing to know is that you're not crazy and you're not alone. Doctors will make you feel, and some of them will even tell you that it's all psychiatric, it's all in your head. I hear that especially from women, but men too. I hear this over and over and over and over and over. So that's number one. Number two, get to the root of the problem. Don't buy into anybody telling you that there is no cause, that it is unknown etiology, as we say, or root cause, or idiopathic. Neil Spector used to always say to me, you know what I say about idiopathic, idiot doctor, pathetic patient. I agree with the idiot doctor part. I don't think that patients are pathetic for not knowing what the cause is, but I do think they are responsible for advocating for themselves. And I do believe that if you feel that you have, there are some great checklists, Lyme checklists online. And the one that saved my life personally was Dr. Joe Burrascano, Burrascano. He is a retired internist and he specialized in tick-borne diseases. He's wonderful. And he had a checklist online. And I suggest that if you have symptoms that are unexplained and once you've ruled other things out, you seek the right care. The problem is that internists and infectious disease doctors even, they get very little training in vector-borne diseases. So my doctor came from Yale, which is in Connecticut, obviously, and it's the hotbed of Lyme. Lyme was, coined and named after Lyme, Connecticut. So after this outbreak of children who had juvenile rheumatoid arthritis. So again, like root cause, that could have just been written off as some weird hot pocket of arthritis. No, it was caused by Lyme. So he said at Yale, he got 15 minutes of training in Lyme and it was all wrong. So if you just consider that, you should understand that you need to go to a specialist, and the only kinds of specialists that I would recommend is somebody trained, is a doctor or another kind of clinician trained by ILADS, ILADS.org. Go to somebody who specializes in tick-borne diseases.
Well, we very much look forward to the release of Chronic.
Thank you.
And we thank you for all your advocacy work and for all the research that you and Dr. Stephen Phillips are putting into this field that desperately needs more information and more advocacy. And we will catch up soon.
Thank you. Thank you for having me. Take care.
Thank you for joining us for this episode of the Ticktective podcast and video series, a program of the Bay Area Lyme Foundation. You can find out more or donate at bayarealyme.org.